Hey, what's up? This is Dr. C. Hot topic alert. How often do you need a dental cleaning? Short answer, that depends on the status of your oral health. What you know as your 3-month, 6-month, or yearly cleaning is a byproduct of insurance cycles. There's very little scientific basis for regular interval cleanings. Before we dive in, back to basics. You're getting a cleaning to remove plaque, which contains the bacteria that causes gum disease. More specifically, the goal is to prevent periodontal disease, defined as the bacterial destruction of bone and tissue supporting the teeth. A cleaning may include scaling, root planing, and polishing. Scaling is the removal of plaque and tartar. Root planing and polishing are ways to smooth down your teeth to reduce the accumulation of plaque. Alright, cool. Remember that we're cleaning your teeth to treat gum disease, right? What category of gum disease do you have? If you don't know why you're getting cleanings, you're likely on some arbitrary recall interval that coincidentally resembles your insurance plan. In my experience, insurance-driven dentistry is standard in North America. But you need a reason for treatment, a rationale. Your individualized diagnosis will ultimately decide what therapy you get. That's right, you should know your diagnosis before consenting to treatment. Shocker, right? So if you're a healthy adult without active periodontal disease, how often do you really need a cleaning? According to a Cochrane systematic review, there is little or no difference in gingivitis, probing depths, plaque levels, and oral health-related quality of life between routine and non-routine cleaning patients. There's also no difference between 6 and 12-month recall intervals. They found small levels of calculus reduction in 6-month recall patients, but the clinical importance of such outcome is questionable. To be clear, we're talking about healthy adults without severe periodontal disease. If you fit that category, there really is no recommended cleaning frequency. I read through Carranza's Clinical Periodontology. It's like the GP's reference guide for perio. Nowhere in the textbook does it suggest set cleaning intervals. If you'd like to have regular cleanings and checkups because it makes you feel better, be my guest, whatever floats your boat. However, if you do have active periodontal disease and or specific risk factors, you may need more frequent cleanings and examinations. For example, if your periodontal diagnosis was generalized severe chronic periodontitis, you'll need scaling and root planing, then a 4 to 6 week reevaluation, and depending on treatment outcomes and the stability of your oral health, a treatment plan custom fit for you. You might even need surgical intervention. The bottom line is that we're supposed to adjust the frequency of cleanings on the basis of your personal risk and progression of your periodontal disease. We're supposed to measure risk objectively. Pocket depths, clinical attachment loss, levels of gingival inflammation, redness, bleeding, radiographs, microbial cultures, all that and more. These measurements yield a diagnosis from which we formulate a treatment plan. If you don't know your diagnosis or why you're getting regular cleanings, ask your dentist. Oh, and none of this treatment works if you're not putting in the effort at home to maintain things yourself. Seriously, your treatment outcomes depend on how diligently you take oral hygiene into your own hands. More on that in my next video. Stay vigilant out there. Don't trust, verify, and peace out.